Mary. Was born in Chalmette. We moved to the North Shore when I was 11 years old, and I came to St. Margaret Mary to go to school for 7th and 8th grade. Father Carol was here that whole time. Had a big history in St. Margaret Mary. We were married by Father Gallagher, and my son was baptized by Johnny Weber, and Louie and I go way back with the fair. So it's really neat to be back here, and I appreciate you all inviting us to speak. And we're going to get some water because I typically lose my voice about this time of day. So as Louie mentioned, I'm a counselor and a clinical director at Alchemy, and really our mission there is to help to, as the name suggests, is help transform lives. People that are kind of stuck in addiction, turning the darkness of addiction into the light, and that process is known as an alchemy process, and so that's where our name comes from. And that really is what our mission is as well. So I want to talk tonight about a little bit about addiction, but would like to ask you guys, so how many people here are struggling with a loved one, somebody they care about, that has a problem with addiction, drugs or alcohol or any other addiction? So most people that are here for that? Okay. I'll start off by telling that my family's been touched by that as well. I had a family member that struggled with addiction for a while, so I kind of get how it feels to watch that from the outside. I understand as a parent the pain of watching somebody seemingly throw their lives away or doing things that I couldn't understand, and asking questions that now I know aren't really the appropriate questions to ask, but the biggest one was, why don't they just stop? Why are they doing this? Can't they see it's hurting us? And then when things started to get a little bit better, immediately insisting that, okay, now go back to school, go get a job. Not understanding at all about, I guess, about the process of addiction, how it impacts a person, how the brain impacts what they're doing. And so that's really important for us to understand. So I'm going to give a little bit of information about that tonight. Addiction, our understanding of it has really changed. And see, it wasn't that long ago that I think addiction mostly was looked at as kind of a moral failing of the person that was stuck in addiction, a weakness maybe, lack of willpower, or they were just choosing to do this as opposed to just choosing to quit. And our understanding of addiction now is a lot more involved. It's a lot more, we understand it now as a biological process and actually a disease of the brain. And, we have a doctor on staff that is kind of an expert in the brain aspects of addiction, the brain disease model. I kind of wish Dr. Caldwell was here, but he explains it really well. But understanding addiction as a disease, as a chronic, complex brain disease, really is helpful as a professional. Hopefully it's helpful to you all as people that have loved ones that struggle with as well, to understand that's not just a matter of choosing to stop. It's not that a person's a bad person that they're doing this. It's that they have a disease whose brain essentially keeps them in a constant state of survival. And that's really, if you boil down addiction and the process of addiction, active addiction, to something, it really is a person who's stuck in survival mode. And when we're stuck in survival mode, we generally do things that we normally wouldn't do. When we are in survival mode, as humans, we seek out whatever it is that gives us what we need. And so it really helps, it helped me at least to understand that that's what was going on with my son. And it made it a little easier to, I guess, to be more compassionate, because the more I understood, I think the better I was able to help him get better. So I'll talk a little bit about that. I think it's important to note that nobody that's stuck in addiction wants to be there. And it's tough sometimes to see that, because we feel like, why can't you just stop? But nobody, because it's these brain processes that are going on, keep them in survival mode, it's not that easy. And so understanding that the person that you are struggling with, that's struggling with addiction that you care about, they don't want to be there. So it's helpful to know that. When you have somebody in your life that struggles with addiction, it seems like there's no hope. I'm assuming that most of you, like me, experience periods of anger, periods of despair, anger with God, blaming myself, and all the emotions that kind of come in between. So it's important that we understand what's going on and how we can help. Mostly how we can help people that struggle with addiction is helping ourselves. Finding the right way to help the people that struggle is really important. I want to talk a little bit about how we can do that and how we can cope as people that have others in our lives that we care about that struggle with addiction. First of all, it's important to note that feelings matter. It's very difficult to watch somebody that you love struggle with an active addiction. It's hard, but it's okay to be mad about it. And I don't know, many people might tell you not to even do that, but it's okay to be mad. It's okay to feel sad. It's okay to feel scared. You have to feel those emotions, because when we have those feelings, and they're appropriate feelings, it's healthy to express those and to feel those. Where we get in trouble is when we get stuck in those emotions. So we have to learn how to experience them, but then respond in ways that are productive. And so it's kind of a hard process to explain, but when we feel these emotions, it's usually best if you have somebody that you can talk to, somebody you trust that you can reach out to, because when we get stuck in these emotional states, having nobody there with us is usually a bad place to be. And really, unless we are well ourselves, we're not able to help someone else get well. So it's really important that we understand part of taking care of ourselves is allowing ourselves to express these things that we're feeling, because they're natural. Probably the biggest thing that I could convey to you all, if you could take one thing from this tonight, would be to understand you can't cope with this alone. You can't do it. It's not possible to do this by yourself. You don't experience the pain of addiction by yourself, and you're not going to get better by yourself. So it's important to have people to reach out to. It's important as well to have boundaries. Probably the toughest thing for me with my son was enforcing, really setting those boundaries, but enforcing them. I think I did everything wrong in enabling him to continue to do what he was doing out of feelings of guilt on my own part, fear that he was going to hurt himself or kill himself. So a lot of the things I did at first really kept him from healing and getting help that he needed. So I want to pass these on to you all. So some of the boundaries that we have to set, and these are really crucial for our own well-being. Financial boundaries are the first one. It's tough to do, but can't give them money. If somebody's stuck in active addiction, you can't give them money. We know what it's going to go for. It enables their addiction, but it also prevents them from facing the consequences of their actions. For most people that are stuck in addiction, there comes a point where the consequences get to be so bad. You know, most people that struggle with addiction will describe it as reaching rock bottom. I had a client yesterday tell the group that he had so many rocks at the bottom, he figured it's time to start putting them together and climb out. But when you experience enough of it, hopefully you'll be ready to get some help. So the boundaries that we set are designed to help people that struggle with addiction to feel the consequences of their actions. Don't pay their bills. Let them take responsibility for their own obligations. It's hard to do. My son was a teenager. And so, you know, he was living with me, and I felt responsible for him. And I made these mistakes. Later learned to correct them, and it really made a difference. But, you know, so don't pay their bills or debts. You have to protect your own assets. If you're struggling with a spouse or parent that's struggling with addiction, you have to keep separate accounts. You have to protect your own assets, because at some point when healing happens, you'll need to have financial resources to kind of put life back together. So it's a tough one. So financial boundaries are important. Emotional boundaries are really important as well. First of all, you can't take the behaviors of a person in active addiction, you can't take it personally. It's not about you, it's their brain in survival mode that are doing these things that are heartbreaking, they're infuriating, but it's really important that you don't take it personally. So their addiction, it was a tough one for me to swallow. It's not your fault. Anybody here at times blame themselves? Yeah, it's easy to do because it feels like that sometimes, but it's not our fault. And we have to understand that if we're going to truly help. So when we talk about emotional boundaries, don't take it personally. Don't let people in active addiction manipulate you. They've got great skills, because when we are in survival mode, we do everything we can to get what we need, and we develop skills to do that. I kind of joke with my clients a lot that the skills they develop in addiction to get what they need in the business world are valued, and you can make a lot of money utilizing those skills. But it's easy to be manipulated by someone that we love when we see them suffering and struggling. We'll be lied to, we have promises made and broken, and that's all part of the addiction. I don't blame the person for it, I blame the disease for it, but I also don't enable it by allowing myself to be manipulated. At least I didn't later. At first I was king of that and got the predictable results. One thing that's important too is don't engage in arguments. When somebody's high in active addiction, arguing with them is not going to be productive. It's best to wait until they sober up. Most of the time you can have a productive conversation if they're coming to the point where they're either willing to admit that something's going on they want to get some help with, or even if they are just maybe ready to get help. When they're high, it's not going to be a productive conversation, and you tend to drive them away, and the consequences get even worse if it escalates into something that becomes physical or becomes violent. So it's important. You need to set limits on how much emotional support you can provide to somebody that you know that's struggling with addiction. We all want to help, but we only have so much of ourselves emotionally that we can give. And you have to, again, be well enough yourself to be able to help somebody. And so that's really important. And all this stuff, I realize, it's easy to say, not so easy to do. And that's why I say you can't do it alone. You have to reach out to other people, people that have been through it, that can help you, people that are trained professionally to do it, people that are trained professionally to help guide you spiritually through this. Because it's going to take you, it's going to take your friends, it's going to take God. And I encourage you to reach out to all of those. Physical boundaries, unfortunately, are boundaries we need to talk about setting, because when people are actively using, they can create an environment that's unsafe for you, for the people in your home, and for them themselves too. So refusing to be around somebody when they're under the influence is important. Doesn't mean you have to kick them out of the house at that moment, but separate rooms, interacting with somebody that's high is not productive again. So there may be times where somebody becomes aggressive or becomes violent. It's unfortunate, and I see it happen a lot with families of people that love each other that would not dream of hurting the people that they love, but it happens. So the encouragement is, if things start to get aggressive or escalate to violence, leave the room. I've had to call the police. Call the police if you have to. Ultimately, somebody going to jail is much better than somebody getting killed or killing someone else or getting hurt. And a lot of times too, that results in them kind of contributing to that rock bottom thing, the place where they maybe start to think, okay, I think this is a little out of control. So it's important. Physically, you have to separate yourself when things get aggressive or things get violent. And then behavioral boundaries, it's a tough one. Don't cover up for it. You gotta be honest, especially with the people you care about. You don't have to lie about their struggles. And I talk about my son's struggles with permission from him. I don't give details out, but it's important. You know, and like most people probably, I hid it. I made excuses, explained away the behavior, explained why he wasn't at the holiday functions, explained why he hadn't seen him in a week because he was in a rehab center. But I learned that wasn't, it was better to be honest. And I wasn't enabling his behavior anymore by explaining it away or making excuses for him. And really, all these things we're talking about they're for our protection, but they're also for the protection of the person that struggles with addiction, because we are not enabling them to the extent that we have control to continue in their addiction. Again, just like any human being, if we don't feel the consequences of what we're doing, then we tend not to learn. Unfortunately, we learn by pain sometimes, physical pain, emotional pain. We learn by failure. We learn to get up and try something different. And so if we enable the people that we love to continue to stay stuck in their addiction, we're not giving them the opportunity to get better. It hurts. I kicked my son out. Had to call the police before. Ultimately, he got into the right treatment program, and he's been sober for quite a while now. So it happens, but it's probably the toughest thing I had to do. I remember when my son was born, does Dr. Lawrence still practice? Dr. Lawrence?
I think he's retired.
Is he? Okay, probably so. It's been a long time. But my son would cry every night and would not go to sleep 2, 3, 4 o'clock in the morning. My wife and I are still up, picking him up, walking around with him. And Dr. Lawrence said, let him cry. I said, doctor, you don't understand. He cries all night. Let him cry. And so the first night, my wife and I sat on the couch, and he was screaming and crying, and we'd take turns holding each other back. And after about 2 in the morning, he fell asleep and slept all night. The next night, we're thinking, oh God, one more night. In 15 minutes, he was asleep, and we never had the problem again. I don't think it's gonna happen that quickly in addiction, but it just shows you the power of letting somebody experience their consequences and how things can change like that. So there are some things to remember with boundaries. You have to communicate them clearly, and you have to be consistent. You know, the reason that slot machines work so well and keep people stuck to them is because you could hit the jackpot in 1 pull, you could hit it in 20 pulls. If you pull long enough, you could hit jackpot. You could spend 10 times more than you win. But so we don't want to reinforce behavior like that. And so it's important that we keep the boundaries, but we be consistent with them. And it's okay for you all to seek help because it's a tough thing to do. Seek help, professional help. Seeking a therapist, it takes strength to do that. It used to be thought of as something that people did when they were weak. They couldn't fix their own problems. Something like this takes, again, your being well, it takes your getting resources, and it takes getting support. Reach out to therapists. Reaching out to your church is important, programs like this. There are lots of programs that will help people not only that struggle with addiction. I'm sorry? Yes, ma'am.
Sorry, yeah.
Oh, okay. Sorry. I mean, not just people that struggle with addiction, but programs that help the loved ones of people that struggle with addiction. My wife and I went to Al-Anon. I was resistant to therapy for a long time, but my son's therapist said, if you don't come, I'm not going to see him anymore. So we went, and he ultimately told us, if you don't go to Al-Anon, I'm not going to see him anymore either. And so I went, I said, I'm going to try this stupid Al-Anon program. And we went, and in one night, I really felt like it changed my life. They have a saying there. It's something called the 3 C's, and it was such a burden off my chest. They said, it sounds so simple. They said that my wife and I didn't cause the addiction, we can't control it, and we sure as hell couldn't cure it. And so that was, for me, freeing because I carried that weight, and I assume it's likely that a lot of you feel that weight as well. Even if you don't feel like you didn't cause it, they help us as to not being able to control it or cure it. But they were very helpful. They helped us understand how to help us, potentially help them, but essentially just how to help us. And so how we could be well and be a resource for our loved one when that person was ready. So there are places like that I encourage you to go to. Deacon Louie, I'm sure you've got plenty of resources, and if you just ask him, he'll help. We've got, on the back table, I've got some information about Al-Anon, addresses and times of some of the local meetings around here, Slidell, Covington, North Shore, a couple in South Shore. But reach out to it because you have to take care of you. And it really is, I don't like the phrase it takes a village, but in recovery, unfortunately, it's a group effort. So what do you do then? If you've got somebody that's ready for help, what types of help are available? And so there are lots of different ways to treat addiction, lots of different levels. I guess the most intensive level is something that most people just call rehab. It's an inpatient service where people go stay at a facility. They have trained clinicians, usually doctors. It's a monitored, controlled environment. Typical stay is about 30 days. Sometimes it can be 45, 60 days. But it takes the person struggling with addiction out of their environment where drugs and alcohol are readily available. It takes them away from family members where the tension could still be there. It gives the caretakers a break too. It's pretty intense. Once they get out, for me, is where there's a potential for a big pitfall, because when you're in a rehab center that's inpatient, you're sheltered from the world. So the options for after rehab are really important. The next step, we call it a step down in treatment, is either partial hospitalization or intensive outpatient. Intensive outpatient is probably the most common. And at Alchemy, that's the primary program that we offer. It allows a person to continue their treatment, and the focus at our program is 4 days a week, 5 days a week for people that want it, 3 to 4 hours a day. And so you're going from an environment of total lockdown, essentially, to an environment where you got a lot of concentrated support, but you're also going home at night, back into whatever environment that you're going to live in once you're finished with your treatment program. So it helps people to acclimate being back in we call it the real world, because when people go from when they go from residential, essentially lockdown, and they don't have that step down back into society, they maybe go to an outpatient level program, or they go to a group a week, or they see a therapist once a week. It's almost like a culture shock, and it can be tough to continue whatever success they've had in inpatient. So it's really recommended that people step down to a high level of care, but that's a lower standard. And so our program's 4 to 5 days a week. Typical IOP program is 3 days a week. PHP programs can be 4 to 5 days a week. I think there are a lot more IOP programs than PHP. Not a lot of offerings, unfortunately, not enough. But we've got information about our program back there too, if you like, and be happy to talk to you about that as well. But no matter what type of help somebody gets, it's important, especially when they're ready, to get help. And the good news is that if they are at a place where they are ready to get help, programs can be pretty effective if you have the right people in place, especially. So a combination of clinical health, therapists, psychiatrists, medical health, medical doctors, sometimes incorporating medication and treatments. There's lots of different types of medications that can be utilized in, it used to be just opioids primarily, but we got medications that help with alcohol addiction, lots of different types of addiction, and they're developing more and more effective drugs each day too. Our program, we allow certain medications, we don't allow all of them, and it's our client's choice. If they choose to be on medication, that's fine, we'll help them. We'll help them find an effective dose, we'll help them detox from it if they want as well. That's an important part of the process as well. Sometimes people need what's called detoxification when they're going through withdrawal because they've stopped taking a substance, usually for certain types of drugs and alcohol included. That process is best medically monitored, and there are medications that help people go through that. Withdrawing alone from alcohol or opiates can actually be deadly. And so it's important that your loved ones seek help that's going to be medically monitored. We offer that service on an outpatient basis so they can get treatment in the daytime, be at home with their families, and still get the same type of medications, so take the same type of medical monitoring. So some people choose to go inpatient, nothing wrong with that either. It's a hospital setting, and they get constant care that way too. But the most intensive levels of care, residential, intensive outpatient, are the most effective for early recovery. Once somebody finishes those levels of care, our program, for instance, is probably 2 to 3 months, depending on the needs of the client. It's not exactly the same for everybody. They'll typically step down to what most people recognize as an outpatient level of care. You go to a group once a week, you can see a therapist maybe once a week. And if you follow those steps down, most people that want to continue to be well will do really well. But again, it takes a treatment team that's made up of medical folks and clinical folks that are really focused on helping your loved one get better. And so we have lots of those options here. North Shore, maybe not so much as New Orleans, but we will help you all find an option that works for you. If it's not at our facility, it's okay. We just want you guys to get help because we've been there. Most of the staff that we have at our facility, probably most facilities, have either been directly or indirectly touched by addiction. And I find it's really important that a lot of our staff understand the impact of addiction, emotionally, intellectually, physically, even not only on the person that struggles with addiction, but on the people that care about it too. So, there are situations where people either can't get help, they're not at the place where they can get help, they're not ready for it, they don't want to do it, they maybe even mentally aren't even capable of asking for it. So there are treatment options that are involuntary. Most of these are in emergency cases where a person is in danger of hurting themselves or hurting someone else. A mechanism that's probably the easiest to utilize is through the coroner's office. Coroners can issue orders that people with either mental health issues that are a danger to themselves or others to be involuntarily admitted to a psych hospital for evaluation. They can also do the same thing for somebody that's a danger to themselves or others for addiction purposes. The process is about the same. You would go to the coroner's office, you can call them, you can go down there, kind of present your case to them. If you present enough that they can make a decision immediately, they can decide and issue an order. They may ask you for some more information. But if they decide that it warrants involuntary treatment, or at least involuntary evaluation, they'll have the police come pick them up and do it. It's nothing that goes on their criminal record. It's just a transport to ensure that they get there safely. And then a doctor will check them out. I don't think there's any specific treatment facility. Could even be a facility they choose to go to. There are a couple of facilities, at least for evaluation, the state works with, that they might send you to at first. But so your loved one can be kind of involuntary placement of treatment. In Kentucky, we had something similar. It's called Casey's Law, but it was a lot longer process. You had to go through court and through a judge. This is a much easier process. It's typically a 3-day hold, just like it would be for psychiatric help, unless it's determined that the person needs longer care. The good thing about the 3-day period is it gives somebody that's actively using, gives them a chance for their brain to clear a little bit, gives them a chance for their body to heal a little bit, and then to get the medical care while they're doing that, so they can maybe make a little smarter decisions for themselves, and it could save their lives. So that's an option that we have here. I can provide information to anybody that wants it with the phone number for the St. Tammany Coroner's Office, but that's an option as well. So there are lots of treatment options. You just have to make sure that you're taking care of yourselves, because you got to be able to be there for the rest of the family, other people that need you. And again, there's a big community out there that's willing to help. So I guess important things to remember. First of all, you're not alone. We've got 25 people in this room. I imagine there's probably about another 10 to 20,000 out there, if not more, that could use some support. So you're not alone in this. You got a church that's there for you. You got treatment centers like Alchemy and lots of others that are there for you. You've got organizations that are designed to help you, Al-Anon, other support groups. Celebrate Recovery is a great resource as well. Do you all do that here?
Not here, but I think it's a journey. Did they have one? Well, I think they got one off the interstate, Journey Church.
Okay, I thought there was one slide out. I didn't know if it's
There
here.
is, yeah.
Yeah, Celebrate Recovery is a great resource for both you and for the person struggling with addiction, because the premise of it is that everybody's in need of recovery from something. And that really is the truth. Of course, we're living in a broken world, and we all truly are in need of recovery, but you add the strain of coping with somebody that you love, watching them struggle with addiction, it can be really helpful. And so that's another good resource. But reach out for help. There's no shame in seeking help. It's a hard sell to my clients sometimes, but it takes strength to ask for help. And a lot of times for our clients, one of the toughest decisions that they make, one of the hardest things to do is to open that door. Once they're in there, they get this sense of, okay, I'm in a place where I can be helped. And then for you too, reaching out, picking that phone up, telling somebody, no, I'm not doing okay when they say, how you doing? When your instinct is to say, I'm fine. It's hard to do, but it's gonna help a lot. So, and you never know too, when we reach out for help, we're giving someone else the opportunity to be of service to us. And you never know, that person being of service to us might be going through something just like you are. There are more people in Slidell in this world struggling with either addiction themselves or addiction of a loved one than there are people that aren't struggling with it. It's unfortunately really rampant disease. Used to be kind of in the shadows, not anymore. So remember, it's okay to ask for help. It's important also to understand this is a process. Recovery is a process. It takes time. You got to give it the time to go through the process. And if you're not getting support if you're not feeling okay yourself, even if you're not feeling okay, if you're not coping with that well enough, that process is going to break down. So you got to give it time. You have to understand that setbacks are going to happen. Recovery is not a straight line process. But the more people are exposed to treatment, the longer they stay in treatment, the easier it becomes to bounce back from the setbacks, from relapses. That's probably the biggest indicator of success for our program is the length of time they stay in the program. Relapses happen in recovery. It's just the nature of the disease. It takes the brain a while to heal. But people that are doing well in recovery have shorter and shorter relapses. So instead of using for a week, they might use for a weekend, and then they might use for a couple of hours. But they're more likely to bounce back. And each time they bounce back, they've got the ability to kind of pick up where they left off. There's a common expression with in treatment that people say, "Oh, I fell off the wagon." Okay, you get back on the wagon. All your tools didn't fall off the wagon, you did. So all the tools that you gather along the way are still there in the wagon. And so if you utilize those, haven't heard that sound in a long time. So if you utilize those, your tools as well as their tools, you're more likely to continue to be successful. So it takes time. Give it some time to process. Focus on, as they say in the 12-step programs, focus on progress, not perfection, because this is not a perfect journey. It's not a perfect process, but progress is important. We constantly stress to our clients to recognize the progress they're making. We generally focus on stuff that we feel like we're failing at, the things we feel like we screwed up. We forget to focus on the things that we're getting right too. And that's really important for you all as caretakers of people that struggle with addiction. It's not easy, but when you have a good day, allow yourselves to say, okay, that was a good day. Tomorrow might be the worst day ever, but I had a good day today, and I'm going to take that and I'm going to try and build on it. You got to practice patience, you got to practice self-care, and you have to practice compassion. We're not going to guilt or shame somebody into getting better. It doesn't happen. We're not going to scream at them enough so they become better. We got to understand what addiction is. We have to understand that it's okay for us to feel those things, but we have to deal with our emotions appropriately with help and respond to them in a way that's going to be productive. That's really the only way this is going to happen. It's hard to do, I get it, but don't lose hope. The main thing is recovery is possible. I see it every day. And I appreciate y'all listening. I'll be happy to take any questions about addiction, struggles, our program, anything you like.
You all deal with co-occurring disorders?
Yes, we do. I probably should have mentioned that too, because addiction often, Louis asking about co-occurring disorders. Addiction is often accompanied by other simultaneously occurring mental health disorders. Sometimes it could be the cause, sometimes it could be the effect. A lot of times people that struggle with mental health issues are seeking relief from those feelings, and they don't know how to get help, they don't know how to get better, and so they'll turn to drugs or alcohol as a way of coping with that. A lot of times drugs and alcohol can cause people to develop mental illnesses because of the guilt and the shame, the trauma that's associated with being in active addiction, and sometimes physically the brain gets altered and damaged because of the drug use too. So we address both of those. We have the only program that I know of that has a staff psychiatrist that's an addiction psychiatrist. He's a specialist in addiction. He actually, at our facility, he trains, Dr. Greg Call. Yeah. He actually, at our facility, we train addiction medicine doctors and psychiatrists for LSU and for Tulane for their medical programs. And we offer that level of care, and most of our patients are Medicaid patients. It's almost impossible to see a psychiatrist with Medicaid, but we do that because we know it's important. Yeah. And yeah, so it's in addressing the mental health issues too, we address it through psychiatry with medication where needed. We also have therapists that provide individual therapy as well. So we don't just put somebody in a group and say, hey, talk to these folks, get some information, and get better. So we offer that. It's important because when you have a mental health disorder occurring at the same time as an addiction disorder.
She thinks you need water.
Oh, I told you my voice, I'm sorry. It's important that you address both because by themselves, it can make the other one worse. But left alone and untreated, both of them can really cause problems. It makes it hard to heal down the road too, so, yeah. Yes, sir.
Do you treat psychiatry, or do you have to enroll in the program to be seen by the psychiatrist?
Our primary care right now is addiction care. And so there are plans to provide ways of treating folks with primarily mental health disorders that come without having to have an addiction disorder, but our primary treatment purpose right now is addictive disorders. We can help people that are struggling with mental health problems too, not necessarily primarily an addictive disorder. But we're gearing up to provide a lot more treatment in that area too, because it's needed here, especially in Slidell County.
So was that a no or yes?
It's a yes. It's a yes that we can look at right now. It's a big yes coming hopefully soon. So if you got somebody that's struggling with that, I'd be happy to talk with you afterwards and see what we can work out for you.
It's not really a question, it's just something silly I want to share. When I first got in, we was talking about the moral thing, and I've been in a while, and recovering alcoholic amongst other kinds of addictions. But KISS, how they have that expression called KISS, keep it simple, stupid, when I first got in. It's now keep it simple, sweetie.
I like that a lot better because
I needed stupid.
well, stupid's something we do.
Yeah.
Usually not describe who we are, but yeah. No, but I like that because you're recognizing the person that you are and not the behaviors that you engage in. And I tell my clients that all the time, don't confuse who you are with what you did.
Right.
Guilt and shame are so prevalent in addiction. It keeps people stuck, not only in addiction, but it keeps them from asking for help. It keeps loved ones from reaching out and seeking help. It keeps us from reaching out to other people that can help us cope with this too. But yeah, don't confuse what you did with who you are. Addiction is a set of behaviors. An addict is not who you are. An addict describes the symptoms of the disease that you struggle with. So that's important. So I'm glad you see that. As a matter of fact, I don't use the word addict. I like to use the word, if I have to use a phrase, it's somebody that either struggles with addiction or a person in recovery. And I like that the best because it kind of
Takes the label away.
yeah, it takes the label away and it emphasizes the person and it emphasizes the recovery part of it. It's not just an addiction you're stuck in, because we're people and we're people struggling with something. Usually to deal with things that life throws at us, we're not quite sure how to deal with. People deal with stuff like that all the time. Drugs and alcohol are just a couple of different ways, but we all ultimately are people really in a fallen world, figuring out how to deal with whatever the stuff life's given us, and acknowledging that helps. It helps the person to see themselves in a way that has potential to get better, as opposed to somebody stuck in this cycle of just being a behavior instead of being the person they are. Do you have a question, sir?
Yeah, do you have any thoughts on the use of Suboxone for opiate addiction?
Yeah, I think medications can be really effective when they're used as a tool. Suboxone is a great tool. It saved my son's life. When it's used as a tool, it can be very effective. Suboxone is not a solution though. The medications that are used in addiction, they're not solutions. They're tools that allow people to stave off withdrawal, to help their brains to start healing and give them time to get the help that they need that's going to be long lasting. But it is, I know there's some controversy, especially when Suboxone and other drugs first came out. The phrase I heard the most, especially from family members, was you're just substituting one drug for another. Unfortunately, they in the beginning especially, there are places that would prescribe Suboxone that way. If you get somebody to take medication that's at the lowest effective dose, you manage it for them, and hopefully over time you taper them off. If that's what they desire, then it can be very effective. Typically used as a long-term solution. I'm not a big fan of that. There may be some people that have to be on it for a long time, but ultimately my goal is to help people to get off of anything, but if it helps them stay alive and gives them time to get some help, it's worth it to me. And we refer to our Suboxone as medication, by the way. It's not I have clients in groups who say, I'm on Suboxone. No, you're not on Suboxone, you're taking your medication. I try to take the street language out of it because they have to make the distinction between a medication that's helping them versus a medication that they're on. I take blood pressure medication. If I lose weight and eat a little better, I wouldn't need it. But in the meantime, I'd rather take the blood pressure med, give me some time to make some of the changes in my life that are gonna help me to be off of it. But in the meantime, it beats the heck out of having a heart attack.
Good
So I
analogy.
kind of look at Suboxone that way.
I'll say organizationally, we, in the most part, for people that need a longer term intervention with a buprenorphine product, which is Suboxone, we'll use Sublocade, which is a injectable. And look, part of this is eliminating options for diversion. Like we're not an organization that promotes, here, show up, we're gonna give you a script, come back and see us. The end goal of what we try to do is get the person well, and get them to a place where they're abstinent, but spiritually free. We believe they're tools, and I think he expressed that really quite succinctly for me, that how we use it as an organization, medications in general. The journey that is a component of what we do, but that's not all we do. And that expectation is clearly communicated. And, for us, it's definitely eliminated some of the population that other people would probably interface with and continue it. Addiction, doesn't matter what the substance is, addiction can show up in any kind of way, so.
And we know this is a process, the healing process that the patients or clients have to do themselves. We offer support, we offer help, and I tell them all the time, I wish we could do it for you, but we can't. And even if we could, that would rob you of the feelings of pride, of self-respect, of dignity that you develop over time when you overcome something like this. Addiction is probably one of the toughest things for a human being to overcome. Ask anybody to try to quit smoking. And when you do make progress and have success, we really help our clients to see that and they feel good about what they're doing. So it's like anything else that you work hard at doing. Most people are proud of achieving a goal that they worked hard at. Because of the stigma of addiction, most people look at overcoming addiction as something that's not noble or something that didn't take strength. They look at it as, shouldn't have had to do this anyway. But look what you did. That's really important. It's really important we understand that it was an accomplishment and it was directly the result of what they either chose to do or not to do. And that's that can be really powerful when that light goes off and they realize, oh yeah, I am doing this. It wasn't my Suboxone that's doing it. It wasn't the doctor that was doing it. It's because of what I've chosen to do or not do. Anybody else? Yeah.
One more. I've got a son that I've been dealing with for 20-some years.
Mhm.
He's been in the VA hospital in Sheridan 3 times. He's been in Cornerstone in Knoxville once. He's been in Oceans. He's been in the one over here in Medina. And he's been in, I don't know how many, halfway houses. At some point, we need to say it's not gonna work, nothing's gonna work. I mean, Suboxone was an answer at one place, Suboxone wasn't an answer at another place. These drugs are what he's gonna need now for the rest of his life, no, he goes to another place, no, we're not gonna do that either. It doesn't work. We've supported him since he was 18.
Yeah. Well, the only thing I can tell you is as long as somebody's still breathing, there's a chance. And it seems hopeless. I've seen many people, just with what you described, the length of addiction and illness, the repeated relapses, pull it together. Doesn't say all of them do. I wish I could tell you that and promise you it's gonna be okay. But I can tell you that if he keeps trying, and if you do what you need to do to keep yourself well, which means setting boundaries like you have to, and it sounds like you have,
He
things,
doesn't live with us anymore.
I'm sorry,
He doesn't live with us anymore.
yeah, that's,
Right now, he's up there by Sheridan.
yeah.
We get help from, an hour's drive away. So, he's a veteran, so that's where it goes.
Yeah. Don't give up. I know it seems, an unsolvable problem. Don't forget prayer. And you probably pray a lot. I don't know why we experience the things that we do. All the things that I've been through, I've been able to use in my work, and in my personal life. I look at the stuff that I've experienced as things I've learned from. And when I do that and I use it to help other people, I feel like it's not just something I had to experience, it's something that really can be productive. I know that doesn't feel like that for you, but you may be able to help some other people that are still going through what you're going through. But don't give up hope. And every time somebody enters a treatment program, there's a chance that it's going to take, even if it's just for a month. The next one could be 6 months. But don't give up hope.
Yeah, he kind of.
Yeah. We got a powerful God too. And I know it seems like it's never going to be solved, but God's capable of some pretty amazing things. And when He's not, I always say, when I get up to God, to heaven, I've got a lot of questions. But He's going to tell me, it worked out, didn't it? Not the way I wanted it to, not that it didn't hurt, but there's always a chance that it could work. So make sure you take care of yourself too.
That's the thing, keep coming back.
Yeah. Anyone else? Okay. I'll be around for a little bit too, as Will Morris, the owner of the company. I want to thank you for letting us come. It's really nice to be back in St. Martin Mary, and we'll be happy to help you all. Our program is on Christian Lane, just down the street, on Robert Road here. Got some literature back there. We're happy to help get somebody who loves the treatment. If it's not with us, we'll help you get them someplace else that's more to suit their needs or their desires. We just want them to get help because we know over time healing is possible. It doesn't seem like it sometimes. It might take a while, but it's possible. So, thank you all very much. Appreciate it.